Almost everyone ignores a swollen lymph node until it's already been there for weeks. And by the time most people finally get it checked, they've already missed the window where it's easiest to catch something serious early. If you've ever felt a lump on your neck, your jaw, or your armpit and just shrugged it off, this video could be the one that changes that. Because there are 5 specific signs that separate nothing to worry about from get this checked now, and almost nobody knows what they are. By the end of this video, you'll know the one sign that surprises even health-conscious people, because it's the opposite of what you'd expect, the exact age where doctors start taking a neck lump far more seriously, and the mistake that makes anxious people feel worse, not better. Stay until the end, because sign number 4 is the one most people get completely backwards. What are lymph nodes? Before we get into the warning signs, let's quickly understand what you're actually feeling. Your body has hundreds of lymph nodes located in your neck, under your arms, your chest, your abdomen, and your groin. Think of them as tiny filters that help your immune system catch viruses, bacteria, and other unwanted substances. When your body is fighting an infection, immune cells collect inside the nearest lymph node. That's why it becomes swollen. So here's something reassuring. A swollen lymph node usually means your immune system is doing its job, not that something is wrong with the lymph node itself. However, sometimes the swelling doesn't behave the way doctors expect during a normal infection. That's where these 5 warning signs become useful. Most people never realize this. A swollen lymph node is overwhelmingly more likely to mean you're fighting off a cold than anything serious. Serious causes are far less common than most people imagine. Upper respiratory infections, the kind you get from a common cold, are the single leading cause of swollen lymph nodes. But here's where it gets interesting. There's a specific field test doctors actually use, and it has nothing to do with how big the lump is. Sign 1, how it feels. The first thing to notice is the texture. A swollen lymph node caused by an infection is often soft or slightly rubbery. It usually has a little give when you gently press on it. A lymph node that feels unusually hard or very firm deserves more attention, especially if that firmness doesn't change over time. A hard lymph node doesn't automatically mean something serious. It simply means it's worth having examined by a healthcare professional. Sign 2, does it move? Next, check whether the lymph node moves. A healthy or reactive lymph node often shifts slightly beneath your fingers. If the node feels fixed in place and doesn't move at all, that's another feature doctors consider during an evaluation. Again, no single sign provides a diagnosis. It's the combination of findings that matters. Sign 3, how long has it been there? Time is one of the most important clues. If you've recently had a sore throat, dental infection, cold, or another illness, swollen lymph nodes often improve over the following weeks. However, if the swelling continues to grow, remains enlarged for several weeks, or keeps returning without an obvious reason, it's a good idea to have it checked. Persistent swelling deserves an explanation. Sign 4, pain can be misleading. Here's something many people find surprising. Pain isn't always the deciding factor. Swollen lymph nodes caused by infections are often tender because your immune system is actively responding. Some more serious conditions may produce lymph nodes that are firm and painless. That doesn't mean every painless lymph node is dangerous. Nor does a painful one guarantee it's harmless. Pain is simply one piece of the overall picture. Sign 5, other symptoms, and where the swelling is located. Doctors don't look at a swollen lymph node by itself. They also ask, have you had an unexplained fever? Night sweats? Weight loss without trying? A cough that won't go away? Those symptoms, together, deserve medical evaluation. Location also matters. For example, a swollen lymph node in the armpit may simply be caused by a skin infection, a recent vaccination, or irritation from shaving. But if the swelling continues to grow, doesn't improve after several weeks, or has no obvious explanation, it's important to have it examined by a healthcare professional. None of these signs alone prove something serious. But when several occur together, it's time to stop guessing and schedule an evaluation. The mistake almost everyone makes. Here's the mistake that makes this worse, not better. If you keep pressing and checking the same swollen lymph nodes several times a day, you may irritate the surrounding tissue and make it feel sore for longer. Instead, check it once every few days rather than every few hours. And here's a myth worth killing right now. Stress by itself doesn't directly cause swollen lymph nodes. What happens is stress can weaken your immune system and make you more prone to the infections that do cause it, or make you hyperaware of a node that was always there. One more, there is no proven lymph cleanse or detox protocol. If you've seen supplements marketed for that, skip them. That's not where your money should go. What should you do? If you've recently been sick and the lymph node is already improving, it's usually reasonable to continue monitoring it. Avoid pressing on it repeatedly throughout the day, because frequent checking can irritate the surrounding tissue. One point that's especially important for older adults. Doctors generally pay closer attention when a persistent swollen lymph node develops in the neck of someone over 40, particularly if it's accompanied by other warning signs we've discussed. That doesn't mean it's cancer. It means it's appropriate to have it examined sooner rather than later. Most evaluations begin with a physical examination, your medical history, and, if needed, simple tests such as blood work or an ultrasound. The most important thing to remember is this. Most swollen lymph nodes are a normal part of your body's defense system and improve on their own. But knowing these 5 warning signs can help you recognize when it's time to seek medical advice instead of relying on guesswork. Understanding your body doesn't mean becoming anxious. It means making informed decisions based on reliable information. If you found this video helpful, please like and subscribe for more evidence-based health videos designed to help you stay informed and healthy.